Good morning. This is another video and we are preparing for NMC CBT test. We read all chapters sequenced by alphabet. We already done A in my last video, so let's start further. B. So what is barrier nursing? Barrier nursing is a protection the nurse wears while caring for infectious patients. Battery. What is battery? When a nurse does a treatment without consent. Biomedical waste. What is biomedical waste? Biomedical waste means any waste which is generated during diagnosis, treatments, immunization of human beings or animals, in research activities, or in production and testing of biological substance. Biomedical waste poses hazard because of its toxicity and infections. Blind and deaf. What are the nursing interventions to the blind and deaf, blind or partially sight patients? First, we're going to read about the blind and partially sighted patients. Introduce yourself always each time you visit it. Help with classes or objects within reach. Let them know when you are leaving. What about deaf and hard of hearing patients? Keep patient in noiseless environment. Maintain eye-to-eye facial expressions. Repeat yourself often for better understanding of the information. Why the blood transfusion is necessary? I hope so you can see properly. It is necessary for severe iron deficiency anemia, sickle cell disease or thalassemia, chemotherapy or stem cell transplants, and bleeding. How long does it take to transfuse a pint of blood? 2 to 4 hours, sometimes a little bit faster, but must be very cautious. What is the most important thing to do before blood transfusion start? Obtain a written consent. Why is it necessary to run blood at a slow rate? Because to prevent from fluid overload. Mention the complications of the blood transfusion. Back pain, heart palpitations, chill, hyperthermia, difficulty in breathing, restlessness, and nausea. The unit of blood is usually confirmed by how many nurses? 2 nurses. To determine a patient baseline, what must the nurse do? Vital signs must be taken in order to determine the patient's baseline. How long must you stay with the patient after transfusion is started? Ideally 50 minutes. Now, what are the body fluids? List the high-risk body fluids which includes cerebrospinal fluid, pleural fluid, pericardial fluid, synovial fluid, amniotic fluid, semen, vaginal secretion, and breast milk. Breakthrough pain. What is breakthrough pain? What is breakthrough pain? Transient. It may be moderate to severe and occurs beyond current analgesic treatment. Rapid onset and very intense. It involves incident pain, pain that can be specifically tied to an activity. An example is a change of wound dressing or physical therapy. Spontaneous pain, it is very unpredictable. The pain cannot be specifically related to time or event of activity. It may be precipitated by coughing. It may occur at any time during the dosing interval. End of dose failure. Pains that occur at the end of routine analgesic dosing cycle, specifically when medicated blood level begin to wear off. This may indicate an increased dose of tolerance and may need medication dose alternatives. Generally, an analgesic with rapid onset of action start within minutes of administration, and short duration of action of about is 30 minutes is required or preferred. Breakthrough pain occurs frequently in clients with cancer. Now the another is C. What is cardiopulmonary resuscitation? What is CPR? CPR is a process of providing oxygen with the use of chest compression to the brain, heart, and other vital organs in a victim who cannot do so for themselves. It is now known as CAB, cardiac compression, airway, and breathing. What actions are expected of a nurse to perform in adults who are in need of CPR? First thing, determine unresponsiveness. Check for pulse at carotid artery for no more than 10 seconds. Perform chest compression in the absence of pulse. Place the victim on a firm place. Locate the lower half of the sternum in the adult. Place one hand over the lower sternum. Place the another hand on the top of the previous hand. Depress the sternum at least 2 inches in adult. Where the pulse is absent, begin 30 chest compression and 2 breath. If the pulse is present, continue rescue breathing and recheck pulse every 2 minutes. For the airways, open the airways, tilt head or chin to the left side, use jaw thrust. If the victim is not breathing, give 2 rescue breaths using mouth to mouth or a pocket mask or a bag mask. To the adult, 1 breath every 5 to 6 seconds, 10 to 12 breaths per minute. Breathing. Maintain the open airways, pinch nostrils closed. Do not give extra breath or forceful breaths. What are the steps for using automatic external defibrillator? Provide CPR until the AED arrives, emergency arrives. On arrival, open the case and turn the power. Select the correct pads for the size and the age of victim. Use pad meant for children less than 8 years old. Attach the adhesive electrodes, one on the upper right side or the chest directly below the clavicle, the other below the left nipple below the left armpit. Attach the connecting cable to the AED. Compressions will need to be discontinued while the rhythm is analyzed. If shock is indicated, loudly state clear and visually check to ensure that no one is touching the client. Press the shock button. Resume CPR immediately with a cycle of 30 compressions to 2 breaths. At what point one can stop CPR? Termination of CPR by the rescuer who is not a medical personnel should continue resuscitation efforts until spontaneous circulation and ventilation have been restored. A physician or a nurse or a physician directed person assume responsibility for resuscitation procedure. Resuscitation efforts are transferred to another responsible person who should continue with it. The victim is transferred to an ambulance or to the paramedics. The rescuer is tired and exhausted and could not continue it. What is catheterization? What are the reasons of urine catheterization? To empty the contents of bladder, example, before and after abdominal, pelvic or rectal surgeries when necessary. to determine residual urine, to allow irrigation of the bladders, to bypass an abstraction, to reduce retention of urine, to enable bladder function tests to be performed, to measure urine output accurately, for example, when patient is in shock, undergoing bone marrow transplantation or receiving high dose chemotherapy, to avoid complication during the insertion of radioactive material. And what are the complications of catheterization? Retention of urine, fistula formation, leakage of urine around catheter, penile pains on erection, pain intolerance, indwelling catheter, and inadequate drainage of urine. CVP. CVP is a central venous pressure. That's a very important one. So, what is CVP? CVP is a central venous pressure. It's measurable device for blood volume and venous return. It reflects right-sided feelings pressure. It is primarily used to monitor fluid volume status. Normal values are from 2 to 8 cm or 2 to 6 mmHg. What are the purpose of measuring central venous pressure? To assess cardiac function by evaluating venous return to the heart, to measure right-sided filling pressure. So what are the causes of decreased CVP? Is hypovolemia and shock. Now another topic is COPD. COPD is a chronic obstructive pulmonary disorder. So what is the meaning of COPD? COPD is chronic obstructive pulmonary disorder. It is made up of three other disorders, namely asthma, emphysema, and bronchiolitis. Asthma is an obstruction airway disease caused by spasms and inflammation, whereas emphysema is a damage to the air sacs in the lungs. And what is the another one? Chronic bronchitis is a long-term inflammation of the airway. So what are the signs and symptoms of COPD? Is breathlessness, coughing persistently with phlegm, chest infection, persistent wheezing, weight loss, weakness and tiredness, edema, chest pain, hemoptysis, and chest of patient with COPD look like a barrel of chest. Let's discuss the causes of COPD. Whatever the cause, COPD occurs when the airways become damaged or inflamed, or maybe is a prolonged cigarette smoking. Another reason is fumes and dust at work, for example, grains and flour dust, welding fumes, coal dust. The another cause may be genetics, and the last one is air pollution. Okay, so what are the treatments which can do for COPD? There is no cure, but of course there is a palliative care. Stop smoking, use of inhalers, medication to ease breathing, lung transplant, use of bronchodilator, for example beta 2 against inhaler and anti-muscarine inhaler, long acting bronchodilator inhalers, steroid inhalers which helps to reduce the inflammation, theophylline tablets or capsules, steroid tablets, antibiotics, and pulmonary rehabilitation. Another topic is chronic kidney disease. What are the symptoms of chronic kidney disease? In advanced stage, symptoms can include tiredness, swollen ankle, feet, or hand, shortness of breath, malaise, or hematuria. What are the causes of chronic kidney disease? Maybe diabetic, high cholesterol, kidney function infection, glomerulonephritis, enlarged prostate, kidney stones, NSAIDs, and polycystic. It is a genetic disease that causes to develop in the kidneys. That's called polycystic, and is one of the cause of chronic kidney disease. So, what is the palliative treatment for this chronic kidney disease? Are there is no cure. The palliative treatments are dialysis, kidney transplant, lifestyle change with the control of high blood pressure and high cholesterol. Okay, what is clinical audit? This is another one of the most important topic which always comes in the CBT MCQs. So, what is a clinical audit? It is an evaluation of a performance against established standards of care. A quality improvement process that seeks to improve patient care against explicit criteria or exact criteria or implementation of changes. Clinic audit is a very important tool in quality improvement for the care of patient, not a find faulty tool. The clinical audit process will help clinicians decide why they are doing a particular audit and what they want to achieve in carrying out this audit. It would also help one to select the right topic for audit. Good clinical practice or evidence-based medicine that is designed for clinical audits. Clinical audit also help clinicians formulate measure of quality of evidence for good practices as a basic data collection, develop data collection protocols and tools. Advance on these data collections on clinical audits while ensuring patient confidentiality, data protection issues and address. This clinical audit will help one to understand the use of statistics for analyzing and presenting findings of that data collection, which help clinicians to analyze course of problem and how they affect the quality of care. It will also help clinicians manage reviews, clinical audit findings with their colleagues and be able to prepare the clinical audit report. So, who are the target audience? Target audience are surgeon, obs and gynecologists, anesthetics, nurse, pharmacist, microbiologist, administrator, infection controllers, physicians and quality managers. What is definition of clinical audit? It is a it is a framework through which NHS organizations are accountable for continuing improving the quality of their services, safeguarding high standards of care by creating an environment in which excellent clinical care will flourish. What is clinical benchmarking? Benchmarking is a comparison and measurement of a healthcare organization services against other national healthcare organizations. It provides leaders with insight to help them to understand how their organization work compare with similar organizations that provide the same services. It also allows for the sharing of the best practices and evidence-based practices, clinical research outcomes between the healthcare facility at the national level. Benchmark can be tailored to specific areas of nursing, such as acute and long-term care hospitals, hospice, and home healthcare facilities. The four core provinces of clinical practice benchmarking are maintaining quality of services, means what are the four important things for making this benchmarking. Benchmarking for important fundamentals are maintaining quality of service, improving customer satisfaction, improving patient safety, and continuous improvement. Okay, now the next topic is what is Clostridium difficile infection? It is an infection that separates mainly by hand to hand contact in a healthcare settings. Clients taking multiple antibiotics for a prolonged periods are at the most risk. Hand washing with soap and water physically removes this bacteria. They can only be destroyed by sterilization and autoclave. Another topic is colostomy. What conditions required colostomy for treatments? Bowel cancer, Crohn's diseases, oral cancer, diverticulitis, vaginal and cervical cancer, bowel incontinence, and the last one is Hirschsprung disease. And what are the types of colostomy? There are four types of colostomy. Number one is loop colostomy. A loop of colon is pulled out through the stoma. End colostomy, this is often permanent. Double barrel colostomy and ileostomy. So what is a stoma? Stoma is usually on the left hand side of the abdomen. The characteristics of stoma is red and moist and sometimes bloody. It's not painful. Stoma vary in different shapes, size, and some are flat while some are in the circular form. Stoma is the site of our abdomen where the tube is inserted. Our next topic is communication. So what is communication? A model in which health workers and nurses conduct a structured and evidence-based conversation is SAGE and THIME. And what is the full meaning of SAGE and THIME? S, setting, A for ask, G for gather, and E for empathy. T for talk, H for help, Y for you, M for me, E for end. So SAGE and THIME, setting, ask, gather, empathy, or THIME, talk, help, you, me, end. What are the barriers of communication? Poor memory, reduced concentration and short attention spasm, distractibility, and generalized fatigue. So now, what are the barriers of effective communication are? Poor communication with patient can negatively affect decision making. Environmental condition, personal emotional distress, impact when providing a supportive role to patient with psychological and emotional issues. Institutions, work environment, and inability to adapt can influence communication. When communicating and assessing patient needs, nurse may be anxious about eliciting distress and managing express concern. Confidentiality and inappropriate disclosure of information about the patient. So, what are the elements of non-verbal responses? The elements of non-verbal responses are SOLER, SOLER. S means face the patient squarely. O, maintain a open posture. L, leaning slightly towards the patient to convey interest. E, eye contact should be appropriately. And R is relaxed. So the SOLER was the element of the non-verbal responses. Now, another is what is the interpersonal communication? Interpersonal communication is a process of discussion between healthcare professional, patient, and caregivers to explore issues and arrive at positive conclusion. And what are the important features of maintaining dignity in communication? Is your attitude, behavior, compassion, and dialogue. So, what is the communication disorder? There are four communication disorder. Number one is aphasia. Aphasia is a required communication disorder that impair a person's ability to process language and not speech impairment caused by damage to the muscle involved with the speech. The second is dysarthria. Dysarthria is a motor speech disorder as a result of neurological or muscular changes causing difficulty in producing speed and coordination of the movement needed to achieve appropriate and articulation for speech. Another one is dyspraxia. Axia. Dyspraxia is a speech disorder that is not caused by muscle weakness or sensory loss, but a disorder of initiating and sequencing purposeful voluntary movement. Another one is dysphoria. It is a voice disorder. It can be supported by writing or drawing for easy communication or by invitation of a sign language interpreter. Okay, the next is compartment syndrome. What is compartment syndrome? Compartment syndrome is a painful and a serious condition caused by bleeding or swelling within an enclosed bundle of a muscles compartment. These syndromes occur when the pressure within the compartment increases and is restrict the blood flow to the area and potentially damage the muscle and nearby nerves. It usually occurs in the legs, feet, arms, or hands, but can occur wherever there is an enclosed compartment inside the body. What are the types of compartment syndrome? There are two main types, acute and chronic. Acute compartment syndromes happen suddenly after a fracture or a severe injury. It is a medical emergency. Whereas chronic compartment syndromes happen gradually and immediately after repetitive exercises such as running or cycling. It is not a medical emergency and does cause permanent damage. And what are the symptoms of this syndrome? We will have intense pain, which is most common when the muscle is stretched, tightness in the muscle, tenderness in the affected area, burning sensation or tingling. What are the three mechanisms from which compartment syndromes occurs? Number 1, trauma with the fracture, trauma without a fracture, and there is non-traumatic fracture. Now, so what are the causes of the non-traumatic fracture, non-traumatic causes of this compartment syndrome? Number 1, intramuscular hemorrhage, nephrotic syndrome, extravasation of the IV fluid, prolonged limb compression, chronic exertional compartment syndrome. So, now what are the causes of compartment syndrome? Acute compartment syndrome can be caused by a broken bone or a crush injury. This is most common cause. The second one is a plaster cast or a tight bandage applied to the limb before it stops swelling. The third one is burn, if the person is burned. The fourth one is surgery to repair a damage or block blood vessels. And the last one is sometimes it happens without any obvious injury. And what is a chronic compartment syndrome? It usually occurs in young people who do regular repetitive exercises such as running or cycling, and it caused by temporary swelling of a muscles during exercise which affect the blood supply to the whole group of muscle. Now, what is the treatment of this syndrome? Number 1, by surgical procedure called emergency by calling emergency fasciotomy. It can also relieve by stopping the exercise that triggers it and switch activity to the less strength activities. So guys, I know the video is long and we have covered till page 40, and in my next video we're gonna continue this alphabet reading from C, and hopefully we cover half of the book in my next video. Thank you so much for listening. Just work hard and pass this exam.